All right, welcome everyone to another episode of the USMLE review series. Today we'll be looking at renal pathology and covering the topic of hydronephrosis. So the outline that I'm going to be using to do these videos is going to be from your first aid for the USMLE. I basically use as a guide and I would basically give you some additional information that's um, not present in the book. So you get a full appreciation for the topic that I'm presenting. So if you like this video, if you find it very helpful, you could give me a thumbs up and subscribe to my channel for more video like these. All right, so for an introduction into what hydronephrosis is, so it's a distension of the renal calyces and the pelvis by urine. So ensure that you review your anatomy to know where the renal calyces and pelvis is. The cause is from urinary blockade at the levels of the kidney. It could be at the kidney, it could be at the ureters that comes off the kidney. It could be at the level of the bladder, it could be at the level as low as the urethra also to cause hydronephrosis. Nature is not a disease really, but it's a physical consequence of urinary obstruction. Um, the incidence, it could be physiologic, and hydronephrosis is common among pregnant women where it's considered physiologic, but it could arise as a result of pathologies, and we'll look at some examples of those pathologies in slides to come. All right, so on this slide is showing a visual representation of what hydronephrosis is. So if we start here, looking at the normal kidney, you would see the calyces would merge into the renal pelvis, and urine would exit the kidney via the ureter and enter the bladder. That's a normal anatomy. In hydronephrosis, there usually is an obstruction at the level of either the ureter, the bladder, or at the ureter, where it would cause distension of the kidney and enlargement of the kidney, and that's known as hydronephrosis. In this diagram here, you could see enlargement of the renal pelvis, the calyces, the major and the minor calyx, with enlargement of the kidney. And when the ureter is also distended, is known as hydroureter. This is another image showing you normal versus an enlarged kidney as a result of obstruction that would cause hydroureter and hydronephrosis. Moving on to the etiology and the pathophysiology. So bilateral hydronephrosis is caused by blockade of urine occurring at or below the level of the bladder or the ureter. Unilateral hydronephrosis is caused by a blockade to urine flow occurring above the level of the bladder. This is important because, as you can imagine, bilateral hydronephrosis would be more severe than unilateral hydronephrosis. Um, Hydronephrosis in general could compromise kidney function. And for example, if one kidney is only compromised, we have the normal kidney to compensate for renal function. But if we have bilateral hydronephrosis, then both of the kidneys are compromised, so that's going to impair total kidney function for the patient. And if obstruction persists, especially in bilateral hydronephrosis, then you could have tubular atrophy and permanent nephron loss can occur. And that's as a result of increased pressures, as a result of the hydronephrosis, which would go on to compromise the vascular supply to the kidney. Hydronephrosis is common in pregnancy, and it's because of one of two reasons. Um, it's because of two reasons, sorry. It's as a result of compression of the enlarging uterus on the ureters and the urinary systems. And it's a result of the functional effects of progesterone. Progesterone would usually dilate the ureters, and that would predispose to hydronephrosis, and that's why it's considered physiologic in pregnancy. The most common cause of congenital bilateral hydronephrosis, and note that this is bilateral hydronephrosis is the one that's more severe, is posterior urethral valves in males. So this condition is seen in males, and we'll look at this condition on the next slide more. All right, so this is posterior urethral valves. As I said, this is the most common congenital abnormality occurring in males that would cause bilateral hydronephrosis. So what is this condition really? So usually, normally, we would have urethral valves which would face anteriorly. So when the bladder neck relaxes, it would allow urine to flow down normally, facilitating urination and expelling urine from the bladder. So in patients born with this abnormal type of urethral valve, known as posterior urethral valve, there's usually tissue blocking the outlet from the bladder. So when the bladder neck relaxes, it does not allow urine to freely pass through to exit the bladder. So what would happen? You would have a buildup of urine backing up into the ureters and eventually into the kidney, and this would cause bilateral hydronephrosis. So this is a condition which can be diagnosed even in utero using ultrasonography by seeing the distension of the kidneys in the fetus and the ureters also, and also noting that the mother is going to have oligohydramnios because usually it's fetal urine that would make up amniotic fluid. So the patient would also have oligohydramnios associated with this pathology. All right, some other causes we could look at, some other congenital causes. We could have the vesico-ureteral reflux. We'll look at this more on the next slide. We could have acquired intrinsic causes like calculi, kidney stones could obstruct either the renal pelvis, could obstruct either the ureters, and cause hydronephrosis. Inflammation, trauma could cause hydronephrosis also. Um, Acquired extrinsic, so pregnancy, the pregnant uterus could um, compress the ureters, also causing a functional type of hydronephrosis. If patients would have tumors of the uterus, like a uterine leiomyoma, also known as uterine fibroids, that could compress the ureters and the urinary system, potentially causing a hydronephrosis also, and retroperitoneal fibrosis also could cause it. Obstruction types could be divided into two, mechanical versus functional. So mechanical is things that physically obstruct the urinary system. For example, the BPH, benign prostatic hypertrophy, or hyperplasia, to be more accurate, that could cause a bilateral hydronephrosis because it's at the level of the urethra. Functional type, neurogenic bladder. This could also cause a bilateral hydronephrosis if we have a bladder which cannot contract adequately to expel urine. We're going to have that urine building up into the ureters and eventually into the kidney also. All right, so we have here vesico-ureteral reflux. So this is another pathology that could cause hydronephrosis, and it occurs in both males and females, and it's a condition that could also be diagnosed in utero. So basically what it is the reflux of urine from the bladder back into the ureters. So normally there should be flow in one direction from the kidney to the ureters to the bladder, but in vesical ureteral reflux, you're going to have the backward flow of urine, and that could increase the pressures in the ureter and the kidney and dilate the system, causing hydronephrosis. Some clinical features of hydronephrosis. So patients might complain of pain. It commonly leads an adult patient to seek medical attention, and it is as a result of distension of the collecting tissue or the renal capsule um, triggering pain for the patient. So the pain is also often described as severe, steady, radiating down to the lower abdomen, testes, or the labia in females. Physical examination of the abdomen may reveal distension of the kidney or the bladder as a result of the dilation of the urinary system, and rectal examination may show an enlarged prostate, and that might be causing the patient to have hydronephrosis, a rectal pelvic mass causing compression of the urinary system, um, and pelvic examination may reveal an enlarged uterus or pelvic mass. Enlarged uterus may be from uterine fibroids, for example. Pelvic masses from the cervix, remember, cervical cancer, cervical masses could also obstruct the ureters in female patients and cause hydronephrosis. So this is something that we should be aware of also. All right, so in terms of laboratory testing for hydronephrosis, especially if a patient has bilateral hydronephrosis, that's going to affect their renal function. That's going to affect their BUN and creatinine. So these patients, if they have their both their kidneys compromised by hydronephrosis, their GFR is going to decrease. If their GFR decreases, then they're going to have decreased clearance, and that's going to increase the levels of creatinine and BUN in the patient's blood. So that's something we could check for. Urodynamic testing may be indicated for patients with neurogenic bladder or suspected bladder causes of hydronephrosis. Maybe if a patient had spinal cord injury, we may suspect a neurogenic bladder as a cause of the patient's hydronephrosis. All right, so the different ways in which we could diagnose hydronephrosis using imaging is something that you need an appreciation of. So the first modality we're going to look at is ultrasound. So the ultrasound could visualize the kidney really well. So as you could see in this picture, we could see a kidney with mild hydronephrosis. We could see a kidney here with moderate hydronephrosis and severe. You could see in the severe, the parenchyma of the kidney is really thin. As you can see here, the parenchyma is really thin as compared to the um, collecting system, that is the calyces and the pelvis. So in moderate hydronephrosis, it's not that thin, but it's still, the collecting system is still dilated. Here you could see a summary of this. You can see here the major calyx, the pelvis, and the ureters. So there's different grades of severity: normal, mild, moderate, and severe. So ultrasound imaging has a sensitivity and specificity of 90% of identifying the presence of hydronephrosis. So it has lesser risk to the patient, and it's a really safe way in which we could diagnose hydronephrosis. All right, so another common imaging modality that's used is the intravenous urogram. So in this method, the patient is usually given contrast, and that contrast is going to be filtered via the kidney, and it would enter the collecting system of the kidney. And the contrast is radio opaque. So if the patient has some sort of obstruction, like hydronephrosis, the contrast material would remain in the collecting system because usually there's stasis in the patient's collecting system if they have hydronephrosis. And usually we will take an X-ray of that patient's abdomen, and we look for the contrast. And as you can see here, the contrast is remaining in the patient's collecting system, and this would be diagnostic of hydronephrosis. So in this image, you can see that this patient has a right-sided hydronephrosis, dilation of the calyx, the renal pelvis, and the ureters also here being dilated. Um, A voiding cystourethrogram is useful in the diagnosis of vesicoureteric reflux, bladder neck, and ureteral obstructions. So what is this um, study really? So it's usually we would insert contrast into the via the patient's urethra using a urinary catheter, and we would look, especially if we are diagnosing vesicoureteric reflux, we look to see if the contrast would leave the bladder and enter the patient's urethra. If usually in a normal patient, it shouldn't, the contrast shouldn't reflux back into the urethra, sorry, into the ureter, but if it does reflux back into the ureter, it would be diagnostic of vesicoureteric reflux. It could also diagnose urethral obstructions. If we instill the contrast via the urethra, um, we would see, and we take an X-ray of the patient's abdomen, we would see that contrast not reaching the bladder, and that would be diagnostic of a ureteral obstruction, or it could be stricture. All right, so another imaging modality we could use is a CT scan. And in this image, you can see here, this is a CT scan from a patient with hydronephrosis. And you can see this kidney, the calyces being dilated. So an advantage of doing CT scans on patients with hydronephrosis is it could uncover the cause of the hydronephrosis really well. For example, it could look for those extrinsic causes of hydronephrosis. So it could detect masses, maybe like the uterine fibroid, which may be causing the hydronephrosis. It could diagnose any other pelvic masses that might be compressing the ureters, causing hydronephrosis. And so it's really good in detecting those causes. So that's a major advantage of the CT scan. The other imaging studies like the intravenous urogram and ultrasound may not give us that detail that the CT scan can give us. All right, so in terms of management of hydronephrosis, we could use medications. So if patients are having recurrent UTIs as a result of their hydronephrosis, they may qualify to be on prophylactic antibiotics. The antibiotics we would use is sulfamethoxazole, trimethoprim, or nitrofurantoin, or based on the spectrum that a patient may have. So as you can imagine, hydronephrosis would predispose patients to recurrent UTIs because um, hydronephrosis allows for urinary stasis, and that would allow bacteria to proliferate and cause UTIs. Anticholinergic drugs like oxybutyrin and tolterodine could be used to stimulate bladder contraction in patients with neurogenic bladder if that's the cause of hydronephrosis. All right, so surgical management. So hydronephrosis with infection is a urologic emergency because that would predispose the patient to sepsis, which could be very deadly for patients. So this is treated very promptly with either retrograde stent insertion or percutaneous nephrostomy. And I explain these procedures in more detail on the next slide. Another thing that could be done is pyeloplasty, and this is a surgical technique for repairing an obstruction between the ureter and the kidney that involves excising the obstructing segment with reanastomosis of the ureter, especially if patients have ureter strictures. This is an ideal surgical procedure to be done for those patients. All right, so this is the percutaneous nephrostomy technique where a connection is made and a percutaneous nephrostomy tube is inserted into the patient's renal pelvis via the skin or percutaneously. So, for example, if a patient had hydronephrosis and it's compromising the patient's kidney function, or the patient has an infection or a UTI, That could potentially lead to pyelonephritis, infection of the kidney itself, and that could eventually lead to sepsis, and that could be detrimental for the patient. So we could relieve this pressure and drain the urine into the catheter bag using a percutaneous nephrostomy tube. So that's one surgical technique that can be done to relieve hydronephrosis, to relieve pressures in the kidney. Another surgical technique that could be done is retrograde stent insertion. So pretty much what this is we're going to be inserting a stent via the urethra of the patient using cystoscopy. And let's say that the patient has a blockage in the ureter. Let's say this is a stone. The stent would allow we insert the stent from the pelvis into the bladder, and it would be able to bypass the stone or the obstruction that's present in the ureter, thus relieving hydronephrosis and preserving the kidney function. So these are two um, methods we have in relieving hydronephrosis. All right, the complications of hydronephrosis, like I said, infection as a result of stasis of urine. Um, Kidney stones is also a complication, especially in the hydronephrosis, which are very long-standing. Hypertension is another uh, complication because if patients would have impaired kidney function and decreased GFR, that could lead to activation of the renin-angiotensin aldosterone system and lead to chronic hypertension in the patient. It could lead to renal failure too. So if untreated, hydronephrosis could progress to renal failure and atrophy of the renal cortex and medulla. Like I said in the beginning, because of the high pressures in the kidney, that could compromise the vascular supply of the kidney and um, cause ischemia to the renal parenchyma. And compromising the kidney would result in elevated GFR, decrease in GFR, and that would lead to elevated BUN and creatinine. All right, so this is the end of the presentation on hydronephrosis. So that's everything that you would need to know about hydronephrosis for your USMLE exams. So if you find this video helpful, please give me a like and subscribe to my channel for more videos like these. Thank you for watching and see you in the next video.